Welcome back to our Conversations on the Couch series. I'm Lindsay Morton, and today I'm joined by Dr. Leah Blackwell, a breast surgeon here in Lee County. And today we're talking about risks for breast cancer. Now, Dr. Blackwell, I know this is a very big topic because there are a lot of things that women think put them at risk for breast cancer when maybe they actually don't, right?
Correct. So, sometimes people are concerned about wearing deodorant or if they had a wire in their bra or something like that. But those aren't really common causes for and known risk factors for breast cancer. You know, the risk factors for breast cancer that are known are female, being a woman, put you at risk for breast cancer. Having an early age of your period, a late menopause, not having any children before the age of 30 is a risk factor for breast cancer, and a family history of a primary relative, a mother, a sister. And so those are the known risk factors. Also, people can inherit genes that can predispose them for breast cancers. And those genes, like the BRCA1 and 2 gene, like the one that Angelina Jolie really raised a lot of awareness about, only happens in about 10% of people with breast cancer, but people can have genes that put them at risk for breast cancer, and some of that is from their family history of other breast cancers and other cancers, ovarian cancers, pancreatic cancers. People with these kind of cancers in their family can also have a risk of breast cancer.
So if someone listening to this says, I've met all of those criteria and I am at high risk for breast cancer, should they start screening early?
Right, so the current screening guidelines from the American College of Radiology are that people start with annual mammography. And it does change, and sometimes when people have an elevated risk for breast cancer, and if they are identified having the gene for breast cancer or a lot of other factors for breast cancer, sometimes they can increase their screening with a breast MRI annually.
Okay. Excellent. Well, thank you so much for joining us today and answering these questions. We want to thank you all for tuning in. We'll see you next time for Conversations on the Couch.